Welcome to the Medical Center Show. I'm Joe Scott, President and CEO of Jersey City Medical Center, Barnabas Health. Today we have with us Dr. Danny Haddad, who is the Chief of Nephrology at Jersey City Medical Center. We'll be right back.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone. Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Welcome back. We're here with Dr. Danny Haddad, who is the Chief of Nephrology at Jersey City Medical Center. Dr. Haddad, welcome. We're so glad you're here.
Thank you for having me. It's a pleasure to be here.
I'm really glad you're here. You are a relative new member of our medical staff.
That's true.
Tell us a little bit about your training and experience.
Sure. So I did most of my training in Philadelphia. I did medical school at Jefferson Medical School, and then.
By the way, you know that's my hometown. So.
That's right. Of course.
I'm a Philly boy.
That's right. And I did my residency at the Hospital of the University of Pennsylvania, and I stayed on there for nephrology as well.
So you did a specialty in nephrology. Any particular part of nephrology, or?
So I did a general nephrology fellowship.
Okay. All right. And then you came back to Jersey City. Why Jersey City?
Why Jersey City? Why not?
That's exactly right. I agree.
My father actually has been practicing in Jersey City for about 30 years, over 30 years at this point.
Wow.
So I joined his practice.
Uh-huh.
And that was one of the big reasons that pulled me back here.
Well, we're glad you came back because you're a great addition to the medical center, and we're so happy to have you on our staff. So tell us a little bit about nephrology. What are when do patients go to see a nephrologist? I mean, is it something that's commonplace? I mean, tell us a little bit about some of the concerns patients might have.
Nephrology deals with kidney disease and hypertension as well.
Okay.
Most of the people that come to nephrologists are people that have a decrease in the function of their kidneys.
Okay.
How
would they know that?
It's very difficult to know by symptoms because it's kind of like hypertension. It's a silent killer. You don't really know until you have advanced stages of kidney disease.
Okay.
Typically, the way we screen people for kidney disease is through a blood test and through a urinalysis where we assess for protein.
Okay.
And using the blood test, we test.
So just so people know, a urinalysis, they just kind of pee in a cup and we look at what's in the urine.
Exactly.
Right?
Exactly.
Wow.
Yeah.
Okay.
Simple test. Simple tests.
Sure.
And we recommend that people that have risk factors for kidney disease to get those tests at least on an annual basis.
Okay. So tell us a little bit about what are some of those risk factors.
Sure. So in the United States, the biggest risk factors are hypertension and diabetes.
Okay.
The other risk factors that go along with kidney disease include cardiovascular disease, people with hepatitis C, HIV, people above the age of 60, people with a family history of kidney disease.
Right.
Those are typically the people that we recommend screening for.
So, and hypertension, typically higher incidence in Black people and in Hispanic people,
That's correct, yes.
So those people, for sure, when they go to their primary care doctor, should be aware that kidney disease is something they might need to be concerned about.
Absolutely, absolutely. And our primary care doctors in the area do a very good job of screening most people. And because the general tests that many primary care doctors are doing do test for something that we call the estimated GFR, which is basically a test that measures your kidney function.
Okay. And GFR is, what's GFR stand for?
GFR stands for glomerular filtration rate.
Okay.
And a simple blood test can tell you how well your kidneys are basically cleaning the blood.
Okay, so the kidneys actually serve kind of as that organ in your body that kind of cleans the blood, comes out in your urine, and you can kind of measure that and see what's going on.
Exactly.
That way.
It's like a big filter.
Yeah, it's like a big filter.
Yeah.
Any other concerns people, I mean, any symptoms that people might have that might trigger them to say, maybe something's going wrong?
Yeah, so especially as stages of kidney disease progress,
Okay.
people may complain of swelling in their legs, in their eyes.
Right.
People can develop trouble breathing.
Oh, okay.
People can develop a decrease in appetite. Sometimes they can develop nausea, vomiting, cramps.
Right.
A lot of these symptoms are non-specific.
Right. Yeah.
But those are generally the symptoms that people may describe if and when they develop kidney disease.
Oh, I see. So they'll see like swelling in their legs. That's probably something that they need to see.
It's one of the causes.
Right.
So there's other things that can cause swelling in the legs, but swelling in the legs would warrant assessment of the kidney function.
Right. So treatments. Now, there's a whole host of things. Obviously, hypertension, you want to control your blood pressure, right?
Yes.
There's a whole series of medications that
Yes,
are prescribed for.
Absolutely.
Yeah.
Blood pressure is very common in the United States as we age.
Right.
The incidence and prevalence of blood pressure increases dramatically.
Right.
But when we look at studies of how well blood pressure is controlled in the United States, it's probably only at best about 50% of people have well-controlled high blood pressure that have already been diagnosed with it. There's a lot of, I think there's a lot of factors that are involved in that. Being on the right medication regimen is probably one of the biggest things, and medication compliance. A lot of these patients are on multiple medications.
Right.
Pills that have to be taken several times a day.
Yeah.
It makes it very difficult.
Right.
And dietary compliance is another big part of that.
Yeah. So there's a whole host of dietary issues I'm sure you have to be concerned about.
Yes.
Yeah, and taking multiple pills can be confusing especially for older people.
Absolutely.
Right? Yeah.
Absolutely.
Yeah. So what is your recommendation to kind of keep healthy for people so that maybe they don't get kidney disease?
Well, if you have any of the risk factors, you want to control those risk factors.
Right.
If you have hypertension, you want to be following with your doctor to make sure that your blood pressure is well controlled and you're meeting the target blood pressure for whatever your risk factors are.
Right.
If you have diabetes, you want your diabetes and your sugars well controlled. We do see that when you do have well controlled sugars, your likelihood of developing kidney disease is much less.
Oh,
so it's extremely important to be in touch with your primary care doctor or endocrinologist, whoever is managing your diabetes, to make sure that your sugars are well controlled.
Okay. So those two risk factors.
Those are probably the two biggest things that people can do to reduce the risk of kidney disease.
Right, right. So being in touch with their primary care doctor or even their nephrologist, right, to make sure that they're being controlled for hypertension and diabetes is essential. We've talked to endocrinologists on the show before, and they talk about diet and how important diet is. Obviously, it's got to be a big issue in nephrology also, right? People with kidney disease.
Absolutely. Yeah. Diet is an extremely important issue. We see, especially we talked about hypertension, high blood pressure can cause kidney disease. Kidney disease causes high blood pressure, so it's a chicken and the egg type of situation. So especially with diet in that situation, you can really accomplish a pretty good reduction in blood pressure just with low sodium diet.
Right.
So we strongly encourage, and that's one of the things we do in our office, is talking to patients about low sodium diet and how to go about that. We also talk about something called the DASH diet, DASH, which is a diet that the American Heart Association has recommended in the treatment of high blood pressure. It's high in fruits and vegetables and whole grains. And it has a low to moderate sodium content.
All right, we want to talk about DASH when we come right back.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org. Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for Nursing Excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org.
Welcome back. We're here with Dr. Haddad, our Chief of Nephrology at Jersey City Medical Center. We were talking about DASH. So explain a little bit more about what that means and why that's important for patients.
So DASH was a diet that was created by the American Heart Association, and its whole goal was to help people in reducing their blood pressure with just dietary changes. And you can actually decrease your blood pressure substantially, almost equivalent to drug therapy.
Wow.
There's a lot that goes into it. There's multiple books on it. There's websites on it. But the gist of it is basically whole grains, fruits, vegetables, low sodium, low fat.
Okay.
And you really can accomplish quite a bit in terms of blood pressure control with that diet.
So typically, if you have a patient who's got hypertension and they're successful in this DASH diet, then they don't have to take medications anymore?
It's possible. It depends on the degree of their blood pressure.
Right.
So you can usually reduce with DASH their blood pressure by around 6 to 7 millimeters of mercury.
Wow. That's pretty amazing.
Yeah.
I'm going to tell a lot of people about that because I know a lot of people who have blood pressure and maybe doing that in combination with their hypertensive medication might also help. Right?
Absolutely, yeah.
Yeah, and but sodium plays a big role in all of this, right? I mean, people throw salt on everything, and when you go to a restaurant, there's a lot of salt all the time.
And that's a
right?
big problem because all the sauces and foods that you eat at the restaurant, you really can't control for how much sodium they're putting in that. And a lot of prepackaged foods have a lot of sodium as a preservative.
Right.
So when you eat out a lot or you're eating foods that are already pre-made, it's hard to avoid
that
the
amount
salt
of sodium.
that's in it.
I've thrown my salt shaker away, so no more sodium for me. I don't go look at that DASH diet. That might help. So clearly there's different stages of renal disease, right? So tell me a little bit about kind of what those different stages are and what patients might be experiencing during that.
Yeah, so we classify kidney disease by 5 stages now, 1 through 5. 1 being essentially normal kidney function, 5 being the lowest kidney function.
Okay.
Most people are referred to nephrology when they have stage 3 kidney disease.
Okay.
And again, when doctors are doing a blood test for screening for kidney disease, they get an estimate of the function. So that number is anywhere from 0 to 100.
Right.
And we use that to determine what stage of kidney disease they are. So many of my patients know exactly what their GFR is, so they know what stage of kidney disease they have.
Wow. And I guess the more educated they are about their disease, certainly the better it is for you treating them, right? I mean, better outcomes.
Absolutely, absolutely.
So what symptoms might somebody with a stage 3 kidney disease have?
They may not have any.
Oh, really?
Yeah.
Okay.
Well, and that's one of the problems with kidney disease.
Right.
People with stage 4 and 5 tend to have more problems. The kidney disease is best treated when you identify it early, and that's when you can slow the progression from stage 3 to a lower degree of kidney function.
Yeah, by making sure you control those things, doing a DASH diet, watching your sodium.
And being on the right medication regimen. We have medications, especially for people that have protein in the urine and have high blood pressure, that can reduce your risk of developing further worsening of kidney function.
Wow. Wow, that's kind of sounds very complicated, but it sounds like if you get control of it, you really can stop yourself from getting worse.
Definitely impact kidney disease.
Right.
Absolutely.
And when you're end-stage kidney disease, then what happens?
So when end-stage kidney disease refers to when you essentially have very minimal kidney function.
Okay.
And that's when you start to have, that's when you have discussions about what to do next. And
Right.
typically we're talking about things like dialysis
Right.
and transplantation.
Okay. And so a lot of people are eligible for kidney transplantation?
Yes. The criteria for transplantation, everybody is assessed on an individual basis. St.
Okay.
Barnabas has one of the busiest transplant centers in
Right.
the United States.
Yeah.
Patients
At
have
St. Barnabas Medical Center.
correct.
Yeah.
Patients have to undergo an evaluation
All right.
for kidney transplantation. It includes their medical problems as well as psychosocial issues, and assuming that they don't have anything that would prevent them from successfully getting a transplant, they become eligible for it.
Okay. And so, and most patients who get a transplant, do they then go back to normal kidney function?
Yeah.
And really?
Just like you and me right here
Yeah.
today.
Wow. Oh, that's amazing. So sometimes patients can't get a transplant or they have to wait sometimes. So then we dialyze them? We
Yes.
put them on dialysis?
We put them on dialysis. Dialysis, there's multiple different kinds of dialysis. And this is why it's incredibly important to be seeing a nephrologist before you get to end-stage renal disease.
Right.
Because you want to have these kinds of conversations well before you develop end-stage renal disease. You want to have a plan for how you would want dialysis, because not one size fits all.
Okay.
The two main types of dialysis are peritoneal dialysis,
Right.
which is dialysis that's done through the belly,
Okay.
and hemodialysis, which is done through the blood.
Right.
Um,
So let's talk about that for a minute. So you can do peritoneal dialysis on the outside?
Yes.
I mean, wow.
Peritoneal the great thing about peritoneal dialysis is it's done at home.
Right.
We have the capability of doing it in the hospital for when patients
Right.
get hospitalized,
Right.
but typically patients on peritoneal dialysis are doing it at home.
Wow. And they do it themselves?
They do it themselves. Some of them have family members that help them do it, but you do not need somebody to help you do it. You can do it by yourself.
Wow. And then the other kind of dialysis is when they put a shunt in your arm and go through that whole process,
Yeah,
right?
and we refer to that as hemodialysis.
Hemodialysis, okay.
And typically people with hemodialysis have a shunt in the arm.
Right.
They go to a center 3 days a week
All right.
where they undergo their dialysis treatments. But even hemodialysis, we have the capability of doing at home as well now.
Really?
Yes.
So does it involve like a big machine or?
So it's actually, there are a couple ways of doing it. One method does involve a fairly large machine, probably the same size as this
Size as
stack
our-
over here.
Okay.
But there's another way of doing it where the machine is probably about this big, so it could
Okay.
actually fit on a nightstand next to you. When we do dialysis at home, we typically do recommend that when you do hemodialysis at home, that there is somebody around in case there is a problem.
Right.
But you
But
learn.
patients do it themselves?
They do it themselves. You learn how to do it.
Wow.
And patients that do it at home tend to do better.
Well, how do you like that? So
They
rather
have better blood pressure control. They have less cardiovascular complications, and they do very, very well.
Wow, that's, I didn't realize that you could do both types of dialysis at home, and patients can pretty much do it themselves.
Yeah.
I mean, it sounds like peritoneal might be a little bit more complicated.
They both patients undergo a training process. Nobody's going home and doing
Right.
this by themselves on their
Right.
own.
Right.
Initially, once you go through a couple weeks of training, you do it with the support of your doctor and nurse.
Wow, that's amazing. Because I would imagine trying to do dialysis and getting to a dialysis center a couple times a week, it's so disruptive to your lifestyle.
It's a challenge.
It really
It's
is.
a true challenge.
We'll be right back with Dr. Haddad. We're going to talk more about nephrology.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.
Welcome back to the Medical Center Show. We're here with Dr. Haddad, our Chief of Nephrology at Jersey City Medical Center, Barnabas Health. So we're talking about dialysis. It's amazing to me, we're talking about how inconvenient it is for patients to have to go to a center a couple of times, but now they can kind of do this at home. That to me is incredible. I'm sure a lot of patients are intimidated by that, right? So there's a lot of training involved?
There is a couple weeks of training that are involved.
Right.
And this is why we encourage people to see nephrology at an early stage, because when you come into the hospital
Right.
with kidney failure, having not seen nephrology, a lot of people go down the default route of going to inpatient, in-center dialysis.
Oh, I see.
Which is not necessarily in the best interest of those patients.
Right.
When patients are seeing a nephrologist prior, they have the time to learn about dialysis
Right.
and the different options and can make an educated decision about what they want to do.
Right. Now, the two different types of dialysis. You talked about peritoneal dialysis and then the hemodialysis where they take it. One better than the other? How do you make a determination on which one a patient might choose?
I really allow the patient to make the decision that they
Okay.
think is going to fit their lifestyle best.
All right.
In terms of peritoneal dialysis, it is typically done every day.
Right.
A lot of times people do it when they go to bed. They connect themselves to a small machine that's next to them,
Okay.
and fluid is put in their belly and drains out of their belly while they're sleeping.
Oh.
They get up the next day, disconnect, and go about their day.
Wow.
So it's nice because it's done during
And
the
patients
nighttime.
can sleep during it.
You can
It's-
sleep
they
right
don't-
through it.
They don't even...
There are times when the machine may alarm,
Right.
But in general, they do very well.
Yeah,
and
I
they don't
get up
have
a couple
problems.
times a night anyway. So. But no, that's amazing though. That they just go to sleep and they're getting dialyzed. That's so much more convenient than going to a
Absolutely.
center. Yeah.
The hemo kind, if you do it at home, we tend, when I said we did in-center dialysis 3 times a week, the patients that do dialysis at home, the blood kind, they typically do it 5 days a week, but for
Okay.
much shorter treatments.
Oh, I see. So they don't have to be tied up for
Yeah.
a longer period of time.
So they tend to squeeze it in either before work, after
Right.
work, or if they're not working, any time of day, but they fit it at their schedule.
Okay. And is there an indication for one over the other, or is it just purely patient choice?
There's patient choice, but there are certain conditions when you have any problems in the belly
I
that
see.
might prevent placement of a catheter. That
Right.
would be the only time that we don't want to do peritoneal dialysis. Or if you have trouble with dexterity of your fingers with attaching pieces,
I see.
then you might not be a great candidate for that.
So you're very patient-centered. I mean, even just talking to you about the different options for patients and getting them involved, really engaging them in their own disease process. Obviously, you sound like you relate very well to your patients, and all the patients should go to you, right?
I leave that decision up to them.
Okay. But you have great training, and you're very, very patient-centered, so that's a great thing. Some patients, though, will be candidates for a transplant. So what's that process like?
So when if a patient's eligible for a candidate or candidate for transplant, they can either get a living donor transplant or a
Right.
deceased donor transplant.
Oh, okay.
So patients can find out from their family members whether they might want to donate a kidney to them, or sometimes they have friends that may want to donate a kidney to them.
Right.
If they have a match, that's great.
Right.
They will go to the transplant center. Each person will get evaluated individually. And if they match, they will transplant one kidney from the donor to the recipient.
Okay.
Even if they don't match, we now have programs called paired exchanges, where if a patient who wants to donate to his family member but they don't match, they may be able to donate to a different person.
Oh, I see.
And that person who matches you, another donor who may
Right.
match you, will give you their
Wow.
transplant.
Wow.
So there's these now complicated paired exchanges where even if you don't match, you still can get evaluated and you may be able to get your loved one
Right.
a kidney transplant.
Yeah.
And the other option is a deceased donor transplant, and that's typically where you have to wait quite a long period of time. The wait list in New Jersey is probably approximately around 5 to 5.5 years for a kidney transplant.
Really? I didn't realize it was that long.
Yeah. We recommend that when patients GFR, so when their
Right.
kidney function gets less than 20%,
Okay.
that they go get evaluated for a transplant, because you can start your wait
okay.
time
I see.
before you are on dialysis.
Right. So that's, and they'll accept the fact that your GFR is less than 20, and that's a criteria for starting to get you on the list.
Exactly.
So 5 to 5.5 years. So, we have a very robust program at the medical center for organ donation. So those organs that are donated during that process are used for kidney transplants?
Yep. Yeah.
Wow.
Yeah.
Yeah, that's amazing. The patients who end up getting a transplant from, say, a family member, is it difficult sometimes for the family members to say, yeah, I'll step up? I mean, how difficult a procedure is it for them?
Every family is different. The
Yeah.
recovery period for the donor is a little bit longer than for the recipient.
Really?
Yeah. The recovery period is short for both.
Right.
But it's a little bit longer for the donor.
Right.
Because they do have to, when they remove a kidney, have to go a little bit deeper to get it.
Oh, I see.
When you receive a kidney, it's pretty shallow under your
Wow.
under your abdomen over
Okay.
here. So it is a conversation that has to be
Right.
had with the donor.
Oh, and I didn't realize that the donor actually has a longer recovery period. That's amazing.
Yeah.
Now, maybe everybody doesn't know this, but you have 2 kidneys. So you give one up, the other one takes over? I mean, how does
Exactly.
that, really?
Yeah,
You don't
yeah.
need both of them.
No, there's an extremely low likelihood of developing kidney failure
Okay,
when you donate a kidney if you are healthy enough to donate it.
right.
So that a donor has to undergo their own separate evaluation to make sure they don't have risk factors for developing kidney disease in the future.
Oh, I see.
And they will not allow you to donate.
If you do have those risk factors. So if
Exactly.
you're diabetic or hypertensive, things we talked about, those things kind of eliminate you from being able to give a kidney.
Yeah.
And so does the other kidney does it get bigger? Does it?
It doesn't physically get bigger, but the cells hypertrophy is what we call it. So
Okay.
the cells do get a little bit larger, and they are able to filter more blood.
Wow. Wow. That's really amazing. And obviously you have the expertise to know how to take care of these patients from your training and from everything else you do at the medical center. We are so happy to have you as our chief of nephrology. We're very excited about all the new doctors who are at the medical center, but you're a great addition to our staff. Patients, if you need a nephrologist, Dr. Haddad's one of the best in the area, and we're happy to have him on our staff at the medical center. He's one of the many doctors who provide great care at our hospital. On behalf of our entire staff, we hope that everybody is staying healthy, and we'll see you at the next Medical Center show.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.